Hello, good morning, good afternoon, or good evening, depending on where you are in the world. I want to show you two pictures and challenge you to think about what they have in common. This is a group of frontline healthcare workers in northern India. And this is a group of Americans who, despite COVID-19 being declared a pandemic, headed out to bars. Right now, you're probably asking yourself why, at the World Data Forum, you're being shown a picture of Americans at bars, and what does that have to do with frontline healthcare workers in India? Well, they have a common solution that can help transform their behavior. AI approaches to segmentation. Whether it is convincing them to stay at home in a pandemic, or providing targeted support so that they can better serve their communities, AI approaches to segmentation can help bring precision to solutions and drive results. In this talk, I'll explain how and why we must use data science and AI to be more precise to both achieve the Sustainable Development Goals, but also end the COVID-19 pandemic. This includes using segmentation as a tool to understand how and why people are different, and also then targeting them with interventions. But before I get into the details, let me introduce myself. My name is Kemp. I am the Director of Programs at an organization called Surgo Foundation. My background is largely in the global health and global development space. I've worked kind of across the ecosystem from USAID in Tanzania to working for Deloitte Consulting and grassroots NGOs in Latin America. For those of you who haven't heard of Surgo, it's an organization that combines behavioral science, data science, and AI to bring precision to solutions that save and improve lives. We partner with major organizations to solve tough challenges such as ending TB in India to the COVID-19 pandemic across the globe. So before I go back to my example around people in bars and frontline workers in India, I want to talk a little bit about the private sector marketing and what we can learn from it. The private sector has long understood that people buy or reject products and services for different reasons. And starting in the 60s, marketers learned that segmenting customers based on demographic factors alone, how old they are, where they live, how much money, is actually not as effective as other ways. And they made the case for segmenting people based on what their behavior was and what was driving it. In what has since been known as psychobehavioral segmentation, companies divide people based on what they do, i.e. their behavior, and why they do it, their motivations, beliefs, and other factors. And this has been wildly successful because it's led to more people buying more products. And it's commonplace across the world from Nike to Pepsi. While there's lots of different types of segmentation that companies can use, a lot of them actually have made psychobehavioral segmentation core to their approach because it improves their bottom line. And they're actually using data science and AI to do it. So you may be thinking, okay, well, they have access to all this data. They can target people with ads on Facebook. Does this really apply to many of those working in low resource settings? My answer is yes, and in ways that you may not realize. So to talk about how, I want to actually share an example going back to the picture of frontline workers in India and how we can use AI-driven approaches segmentation in a place where smartphones are actually more rare than cows. Uttar Pradesh. Uttar Pradesh is a state in northern India larger than most countries with a population of over 200 million. But it has one of the highest rates of infant and maternal mortality in the world. Frontline healthcare workers are critical to improving these outcomes. And they provide services in their communities, from counseling families on family planning to providing postnatal care checkups, actually going and checking up on mothers and babies after they come home from the hospital. And in some areas, they have achieved tremendous success helping women get to the hospital to deliver. They've actually gotten 80% of women to now deliver in a hospital. But in other areas, like facilitating prenatal care checkups, well, they're not achieving their goals. Only 30% of women actually get the recommended regimen of 4 prenatal care checkups. Why? We partnered with the Bill and Melinda Gates Foundation, the India Health Action Trust, and the government of Uttar Pradesh to ask a very important question. How can we empower frontline healthcare workers to drive outcomes in their communities? At the outset of our work, we sought to understand what frontline healthcare workers are doing, but also why. Why are they behaving in certain ways? And so we used our behavioral framework, it's also known as CUBES, to actually comprehensively map out what are all of the potential drivers. And then we surveyed 1,500 frontline healthcare workers, both on what they do and why they do it. And when we started looking into the data, we saw a lot of heterogeneity. And so we actually realized that we needed to find a way to quantify these differences in a way that the government and our partners could actually intervene upon, that they could do something with. And so we turned to AI approaches to psychobehavioral segmentation and found 5 really distinct types of frontline healthcare workers. I'm just going to talk about 3 to illustrate the point. We've got one segment, the undertrained but motivated. This type of frontline healthcare worker works really hard, but actually lacks clinical knowledge, and they desperately need more clinical training than all of the other groups. But they're getting trained on the same schedule as everybody else. Another group, another segment, the financially troubled and hands-off, this group is actually really struggling around the incentive system, which is how they get paid. And that's actually impacting her ability to serve her community, and really needs help in that area. Another segment, the independent high achievers, this segment is doing a phenomenal job supporting their communities. But what's holding her back is actually the support from her family. These frontline healthcare workers are all really different. And what's clear is that a one-size-fits-all approach is not going to serve the needs of these different segments. And so we actually need to take a precise approach to target particular interventions to particular frontline healthcare workers' needs. And we can do it in a place that doesn't require smartphones, actually. So for example, we using a simple questionnaire that is actually built on AI algorithms, a supervisor could ask a series of 5-6 questions and actually identify which segment a frontline healthcare worker belongs to. And from there, they can provide the right type of support. So they could connect the undertrained frontline healthcare worker with refresher clinical training that she desperately needs. They could provide targeted support to the ASHA who's struggling, the frontline healthcare worker, they're known as ASHAs in India, to the frontline healthcare worker who's struggling with the payment system. They could, perhaps even for the independent high achievers, a different intervention. They could go and have a conversation with their family. These types of targeted interventions, powered by data science and AI, could actually help equip with the frontline healthcare workers with the skills that they need as individual groups, and the support that they need to drive the outcomes in the communities, from getting more women into checkups to counseling on family planning. And at the same time, actually taking this tailored and precise approach, you could save resources. For example, you could target your refresher clinical training to 50,000 frontline healthcare workers instead of offering it to all 200,000. So you may be wondering, okay, that's really interesting story, but what does this have to do with Americans going to bars? It turns out that AI approaches to segmentation can be actually used to help end the COVID-19 pandemic as well. Until there's a vaccine, social distancing, or as I like to say, physical distancing, and mask wearing are some of the most effective things you can do to control the spread of COVID. But they require individuals to change their behavior. I'm going to talk about a specific example around social distancing, but the same exact concept could apply to masks or even vaccines. So, as all of us, I think, remember very, very clearly, in February and March, large parts of the world entered mass lockdowns, closing schools, restaurants, bars, gyms, markets. Some countries did this through policy directives, enforceable with fines and criminal penalties. Other places, like the US, took a mixed approach. Some government lockdowns, but also relied on individual choice. For those of you who know Americans, you know we love our freedom. But this also resulted in some Americans staying home, not even leaving the house to get groceries, and others continued going out with friends, frequenting bars and restaurants and gyms. Why are people responding so differently to the pandemic? And importantly, who are the people who are not social distancing? I'm going to call them the non-social distancers. Are they all the same? What's driving that? And can we target specific groups with specific messages and interventions? So to answer that question, we first had to collect good data on what people were doing and why they were doing it. We surveyed 2,500 Americans in a nationally representative panel and actually began analyzing the data. And when we dug in, we found an enormous amount of heterogeneity. Social distancing is complex. There's no simple yes or no, and the reasons why are also complex. So again, we turned to AI-driven approaches to segmentation, and we found 4 different types of social distancers. These segments differ both on the drivers of whether they social distance, as well as their actual behaviors. So I'm going to just talk about 2 to kind of share the point. The 2 groups who actually had the lowest rates of social distancing. So segment 4, this group had the lowest rate of social distancing, only 25%. And why? Well, they had a moderate perception of their community norms. They perceived somewhat that people in their community were social distancing, but they did not see COVID-19 as risky. And they also didn't believe that their actions mattered, that their actions could help control the spread of COVID. And they also weren't seeking out information on COVID. In contrast, segment 3, the second lowest social distancer, they were driven by a very different reason. They actually saw COVID-19 as risky. They believed their actions mattered, and they went out and sought information about it. But they didn't see social distancing as a norm in their community, and so they social distanced less. From this example, you can see that different interventions are needed for these 2 different population segments. Segment 4 needs to be convinced of the risk of COVID, that their actions matter, and we've got to reach them through entirely different channels because the channels that exist now just aren't working. Segment 3, for example, well, it's quite different. It's more about how do we convince them that social distancing is a norm in their community. Psychobehavioral segmentation driven by AI has tremendous potential to help transform how we design and deliver programs. And to get it right, there's 3 things that we need to keep in mind. These are actually things that I've personally learned implementing it on programs. First, it is all about the data. We all know, right? Good data in, good data out, good insights out. But you have to start with good quantitative data. If we want to understand how people are different, we need to collect data on their behaviors, but also potential drivers of that behavior, as well as things that we standardly collect like sociodemographics. Second, it's a team endeavor coming up with segmentation. The ultimate goal really is to inform how programs are designed and delivered. And that means you need to incorporate program knowledge from the beginning. What can we intervene on? What makes sense? What's been tried? Otherwise, you may end up with a segmentation solution that we just can't act on. And then lastly, applying segmentation to your data is both an art and a science. It's good to experiment to find a solution that works, and one that we can actually implement. This could mean a number of different things: creating composite variables, or actually trying different algorithms. For example, you can use algorithms that split data hierarchically, or you can use unsupervised clustering algorithms such as k-means. With this experimentation, it's important to really critically evaluate the outputs and the solutions to see what can you actually act upon, what's practical, what's feasible, what's implementable. I want to conclude with just a few thoughts. We have, as we all are, I think, all too aware of in this moment, we have tremendous challenges ahead, from ending the COVID-19 pandemic, mitigating all of the social and economic setbacks that it's caused, and continuing to make progress against the SDGs. Meeting these challenges requires us to expand our toolbox, but also to bring precision to solutions. Psychobehavioral segmentation is one proven tool that we can take and apply to our data that will help us deliver the right intervention to the right person. Think about how much more effective our family planning programs could be if we could target couples with specific messages and interventions that meet their individual goals and needs. What do they want for their families? How much more effective could we be at getting farmers to adopt climate-smart agricultural solutions if we tailored both the intervention, the support, and the messaging to what's going on their farm? What are they concerned about? What's important to them? How much more effective could we be at ending and controlling COVID-19 if we could effectively target the mask holdouts, the non-social distancers, or even target people with tailored information once the vaccine is ready based on what they're concerned about and what matters to them? With enormous challenges and limited resources, we need to act with more precision. And AI-driven approaches to psychobehavioral segmentation are a powerful tool to help bring that precision. Let's use it. And that's it for me. Thank you everyone for listening. Again, my name is Hannah Kemp. Feel free to reach out to me on Twitter, or I think my email is somewhere. I look forward to hearing from all of you. Good morning, good afternoon, and good evening.